Can you guys introduce mommy?
Spill the beans with Dr. Jail.
Hi, everyone. Thank you so much for joining on today's episode of Spill the Beans. As always, I'm going to invite my guests to introduce themselves.
Hi, everyone. My name is Dr. Shaneisha McMillan. I am a registered nurse, but I'm also a certified registered nurse anesthetist. I have about 14 years of experience as an RN. I initially started out as an RN in a kind of like a group home facility working with the intellectually disabled. And then I went on to medical surgical nursing, which I did that for about 5 years. And then from there, I went on to medical intensive care unit nursing. And I did that for about 4 years before I decided to go back and get my doctorate of nursing practice, specializing in anesthesia. So I graduated with that degree in 2024. So I've been enjoying the world on the other side as an advanced practice provider, and I love it.
I don't know about the audience members, but I'm exhausted listening to all of your accolades. How long have you been in school? How many years?
So school was, I did 4 years to get my bachelor's of science in nursing. After that, while I was a travel nurse, I decided to get my master's of science in nursing education. But I did not complete that degree, not because I couldn't, but because I decided I didn't want to. I wanted to pursue a doctorate degree instead. And if I'm paying for it, I'm not going to pay for a degree that would be useless. So then I went on to get my doctorate degree, which was a 3-year program,
Wow.
full time.
So I would say a decade. You've
Yeah,
been
close
in
to that.
school
Like
for, yeah,
I was definitely in school for like 9 years, but for
yeah,
to achieve what I have, 7 years total for that specific
wonderful.
degree.
In your program, along the journey, did anyone ever talk to you about your vicarious trauma?
Never, never. It's a new term for me. It's definitely a new term. I know informed trauma care. I know
Yeah.
burnout, but I
Yeah.
don't know vicarious trauma.
And so, did anyone ever talk to you about your self-care?
I would say as an intensive care unit nurse, it was more so discussed in that arena because we deal with so much trauma. We deal with violence, we deal with death. Death is not something that occurs every once in a while. It's kind of like it can be an everyday thing
Yeah.
depending on what's going on with patients or a weekly or monthly thing. So I will say it was discussed more when I was in that specialty.
So, what my work and research indicate is that when you don't nurture your vicarious trauma, it becomes burnout. Have you seen colleagues be in the burnout area and maybe you've kind of in head judged and said, I don't want to ever become like that?
Yeah.
Yeah.
So when I was a med surg nurse, for people that are not aware, medical surgical nursing is a specialty, but most people don't deem it to be a specialty because it's basically your ground level entry into nursing. You become a nurse, you go to med surg, um, you take care of sick patients, but there are patients that are walking, talking. You have a heavier load of patients. So you're dealing with, when I was a med surg nurse, I would have 6 patients most of the time, sometimes five, until I became a travel nurse where it kind of decreased and it was about 4 patients. But so you're dealing with 6 patients with multiple different diagnoses and psych disorders and medical disorders. So that can cause a lot of strain and burnout on one person because you're dealing with 5 to 6 patients a day for 12 hours. And contrary to popular belief or what people know, the nurse is in the room with the patient all day, all the time, carrying out all of the orders and duties. So you can become burned out very quickly as a medical surgical nurse. That's why people do not like doing that specialty. I saw coworkers burned out. I saw people that didn't want to be there. I saw people where I'm just like, oh my goodness. I never in my life as a nurse want to get to the point where I don't even want to take care of my patients or I don't want to come to work. I come to work with a bad attitude. I leave with a bad attitude. I treat my patients horribly. I treat my coworkers with little respect. So yeah, I definitely was in that phase before.
One of the things I talk about is protective factors. And these are things that we can, some of them we can control and some of them we can't, that help us to manage our vicarious trauma. The other thing that I talk about is you and I can deal with the same patient, the same
Mhm.
client, and have the same caseload, but one case would resonate differently with me than you for a variety of reasons. And it doesn't need to be this egregious trauma. right? Like a car accident or like something where it's like, something a scene from a movies. It doesn't need to be a severe trauma. It could just be a severe trauma to us, right? And so
Yeah.
that's going to change based on your upbringing, your background, your expertise, your personality, all those kinds of things. With that being said, is there any strategy or ritual that you have done that has helped you to kind of leave work at work or to process your cases better that you can give that wisdom to the audience?
Yeah, definitely. So, as a medical surgical nurse, I definitely left work where it was. It was straining. It can definitely cause burnout. I liked exercising. So when I got
Right.
off of work, we had work long shifts. I would go to the gym, and on my days off, I would do kickboxing. I
Mm,
got heavily
same.
into, yep, I got heavily involved into kickboxing. A pitch to I Love Kickboxing. They got me into kickboxing. That's a program that's like nationwide, but I
Yeah.
absolutely loved it. So I did it while I was home in Connecticut. And then when I became a travel nurse, I stuck with exercising because and my dog traveled with me. So
Oh,
being with
wonderful.
him all the time definitely made me feel better. And having a companion of any sort, like human, animal. So for me, it was animal. And yeah, he definitely brightened up my days knowing that I was coming home to Littlefoot and then also exercising. So we'd exercise together and then I'd go to the gym. And then I also got into, besides kickboxing, I got into, what do they call it? What's the other one where you do rigorous training?
Oh,
I
like
just had the name.
CrossFit?
Yes, CrossFit. I just
Yeah.
had the name of it on the tip of my tongue. So I also got into CrossFit. That helped me. And then honing in on my self-care and my how healthy I should be. I started eating healthier, getting into subscriptions that give you healthy food that gets delivered to you. So that was kind of my outlet to make sure that I can be healthy in my own state so I can go to work and take care of my patients and then leave all of the stress at work. When I became an ICU nurse, it was more so leaning on the nurses on my unit, more so that looked like me. So we had a group of girls where we said every 6 week schedule, we're going to get together, we're going to leave work at work, and we're going to release our stresses by hanging out with each other. And each time, one person had to pick an activity and then pick a place to go out to eat because we love to eat. So that's how I dealt with it as an ICU nurse.
And
And I
that's
will
very different.
say, oh, sorry.
No, go
I
ahead.
will say initially it was hard. When I first became an ICU nurse, there were code blues going off constantly, and I'm not gonna lie, I would go home, and this is where I think the trauma comes into play. I couldn't sleep. I'd wake up with code blue noises going off in my dreams, and I'd wake up like I gotta run to the code. That
Yep.
happened to me for like the first couple of months in the ICU because I just kept hearing code bells, code bells, code bells. Oh my gosh, I gotta run to the code. Oh my gosh, my patient's coding. Let me go. I gotta leave lunch early because there's a code bell going off. So it was difficult in the first couple of months. With that experiencing what I didn't realize then was vicarious trauma, like secondary trauma for me.
Exactly. And that association with sounds also could be vicarious trauma and fireman syndrome, which doesn't really leave us. If you heard those sounds now, you probably would go into adrenaline up a little bit, cortisol levels, and then you would assess and say, actually, that's not my problem to deal with. It's addressed because you're never really off, right?
Hmm.
If we're in the grocery store and they say, is there anyone here medically trained? You would have to step up,
Yeah, run. Yeah.
right? So we have to acknowledge that that's why this season is dedicated to the medical profession because when we say we're leaving it at work, it's you can't really leave all of you at work because this
Hmm.
is the oath that you made, right? Is to serve all in times of need. So special nod to the medical industry right now. Um, I want to go back to you talked about like that community aspect with other ones that are doing the same job. And I think what's so important that I want to clarify for the audience is that you all were not case managing after hours. You are not trauma bonding. You are not talking about the cases. You were very intentional of we are going out to dinner and doing something else other than what we do during the day.
Yes.
And that I think is amazing because so many colleagues will say, well, I get together with my colleagues, but all we do is talk about work. And I'm like, that's not really nurturing your
Yeah.
vicarious trauma, right? So you're creating new memories with the same people that you see during the day during the trauma.
Yes. Yes,
That's like
yes.
textbook what I would want for people to do. The other thing that I know about you is that you are heavily involved in the community and that
Mhm.
you do have clusters. Do you want to share a little bit about what your community outreach looks like?
Oh yeah. So I do live in Maryland now, and throughout my time as a sorority member of Zeta Phi Beta Sorority Incorporated, I was heavily involved in the community. Moving around often has kind of prevented me from being involved directly in the community in Connecticut, which I do miss. But as far as in terms of Maryland, I have gone to, I volunteer at different, what is it called? The Maryland Food Bank.
Mhm.
In recent years, with getting my doctorate degree, I more so have volunteered my money as opposed to my time. And then also, I am a mentor to with my time since anesthesia is near and dear to my heart and I love it so much. Now, with my time, how I'm contributing back to the community is developing and building students that can, or ICU nurses that can then move on into anesthesia. It's very difficult to get into our programs. They're rigorous. There is a lot of competition. There's 600 applicants and they can only pick 200 to interview and they can only pick 30 to go to school. So I kind of spend more of my time donating my time and giving my time to people with interview help. How can you make your personal statement better? How can you interview at this place? What are the things that you can look out? And then when they do get into school, I then continue to mentor them. So I have a few mentees. And then I developed another relationship with another mentor or mentee that is not in anesthesia school yet, but is working on her way in a program to get into anesthesia school. So that's what I am more so devoting my time to, but I still donate like money to other community achievements. And then sometimes when there are community events in my community, I do community cleanup. And when I go back to Connecticut, I do try to every year do the Thanksgiving community event in Bridgeport where we donate food and clothing to people that are homeless or not even homeless that just need a Thanksgiving meal.
And the reason why I nudge these things for you to share, not for the audience members to now feel like they're not doing enough, right? Because you're doing so much. It's because two things. One, because of the bonds that you have with your sorority, I want to assume that at any given time, if you had a bad day at work and you were really in it, that there is someone on your phone that you can text and
Most
say,
definitely.
girl, I need an ear. I need, I need to be lifted up in this moment. You've created that protective factor, right?
Yes. And they probably get sick of me, but I'm on the phone
Probably never.
right on, like, oh my goodness, we need to talk about my day today.
Yes, that is so important as a protective factor. And the other thing that you mentioned with the community was your partnership as a mentor to mentees. That is a protective factor because it is important that when we're in these jobs that are depleting and suffocating and can be very negative, that we're reminded that there are people that want to be us and that we can
Mhm.
share that wisdom and be rejuvenated. So it actually is proven that if you talk with a mentee about your job and help them, that that's managing your vicarious trauma. So you're doing everything that I would want people to do
Oh, I
without
try.
even knowing it. And
I
then
didn't
I think
know.
that that's amazing, and it just goes to show you that you're more self-aware that even if you weren't taught this in the academic space, you've seen it probably because of COVID. I am going to assume that the way that you think about the work that you do shifted a bit from the pandemic and that you've really surrounded yourself with some great protective factors. Um, if you had to give one tip to anyone listening about your profession, what would that be?
Um, okay. One tip. I mean, my current profession in anesthesia.
Yes.
Okay. Don't give up. Don't
Yeah.
let anyone tell you that you cannot get into anesthesia school. It may take you one try, it may take someone else 10 tries. Do not give up. No matter if it's for you, it will be for you. If it's God's will, it will be your thing. Seek out and seek mentorship from people that are in the field that already have experienced going through school, going through the application process, and then going through clinicals, which is also rigorous. It's 20 to 22 months of clinical in the OR setting. And then don't give up when you feel like throughout the program, you're hitting a low point. That's going to happen. It's rigorous, it's difficult, it's advanced in information when you focus on anesthesia and how it works in the entire body for multiple different patients. So I just feel like don't give up and don't let anyone else tear you down. And if you feel like you're getting in moments where you're experiencing the I don't belong, I shouldn't be here, reach out to someone. Have a group of friends or one friend or a family member that you can lean on and ask for advice or share your experiences and tell them, I just need you to listen. If you don't need someone to give you advice, say, you to listen to make me know that I am the person that I am and I should be here. Always remind yourself that you should be here. And then my thing that I had throughout school was my quote was, you got this. So
Mm.
all throughout school, I would always say, "You got this." I had it on my planner. I had it on my phone. I had quotes all around the house to help me remind me that I am who I am and I should be here and I got this. And I did.
I love all of those statements because I always end the episodes with asking the participants to spill the beans, and you've given us some really great mantras. If you had to do it all over again, what would you change, if anything, about
Um,
the process, yourself? What would you tell to that person years ago?
Years ago, so I didn't really, anesthesia is widely discussed now, especially on social media. So many people know what a CRNA is nowadays. So the only thing I would change differently was doing it sooner. Like instead of at year 9 applying to anesthesia school, how about I go into the ICU much sooner? And then if I went to the ICU much sooner, I would have probably found out what a nurse anesthetist was much sooner. And then I would have gotten to the field years ago instead of just getting into it and starting school in 2021. It would have definitely been much sooner. I don't regret anything that I did. My med surg experience, even though people think it's the slums, people don't want to be there. It formed me to be the nurse and the person that I am today. It teaches you hard lessons that you need to know. I don't regret my ICU experience. It was one of the best experiences I could ever experience in life. And then I definitely never regret becoming a nurse anesthetist. It's the best profession to me. I'm biased, but it's a great profession.
So I would love to end with you differently than I end with everyone because the work
Okay.
that you do is very heavy. And so I want to end it on a lighter note. What TV show brings you joy? Is there
Oh,
anything
I'm a
out
crime
there?
buff.
What's that?
I'm a crime buff, so
Oh,
I love a lot of TV shows and I'm into drama. Oh my goodness. I have like 15 favorite TV shows. What I am catching up on now, I will just keep it simple and just do what I'm catching up on now because I'm behind. Law and Order, Organized Crime is what I'm
very
catching
nice.
up on now.
Thank you so much for sharing about your expertise, your journey, letting us see you and your personality. And I think it's so important for the audience to know that these practitioners are people and taking care of themselves needs to be on the forefront because they can't take care of us if they don't do that. So now when I watch Law and Order, I will think of you and be cheering you from afar. And on that, I thank you all for watching today's episode of Spill the Beans. Thank you all. Hi, everyone. Thank you so much for watching today's episode with Spill the Beans and Dr. McMillan. She is such a joy to talk to, and there's a couple of reflection points I wanted to talk about. The first thing is that this is someone that in their email quotes Michelle Obama, and I'm going to share with you the quote. You can't make decisions based on fear and the possibility of what might happen. That is essentially talking about vicarious trauma. And here's where I'm going to go with that. When we are in the moment of hypervigilance or fear or anxiety, we might make decisions based on those emotional responses. And this quote and Dr. McMillan referencing it, I think is very poignant because every now and again we need to take a time out, take a deep breath, and reassess. And one of my supervisors once said, you never make a serious decision in the moment that could wait overnight. And I thought that was like really helpful for me because now I do more reflection, big decisions that can wait. I take my time to really process them and deliver them the next day. Now, in the medical profession, we know that they're making a lot of quick, high level decisions based on the data and the information that they have. And one of the things that this speaker stressed was not giving up and having that reassurance that you've got this. Now, I think that what they're referencing, actually, I know what they're referencing because I listened to the speaker talk about their resiliency that they've built, and that you might start your journey and then take a detour into a new direction to say, I know now what my passion is going to be, and I'm not going to give up that goal. And that's also really valuable for us to be mindful of, that you got this and don't give up doesn't necessarily mean that it's going to happen overnight, but that if we stay true to ourselves and what our goals are, that nothing can get in our way. And to have patience with yourself along that journey is another thing that I took away from today's session. The last thing that I'll share with you about this participant in particular is they were referred to me by way of a third party. And I can't stress how thankful that I am that my network has allowed me to bring to you some absolutely amazing practitioners. I don't know a world where I would have met Dr. McMillan, especially when she's located out of Connecticut, where I'm located. And so I am so grateful for those of you that have referred someone to me and made the introductory, and even those that don't know me and said, yeah, I don't really know much about this topic, but if you want to talk to me, let's do it. These interviews and these conversations are genuinely the highlight of my day, aside of my family and friends. This kind of conversation makes me smile. And I hope that today you were also smiling with us. So thank you again for watching. Bye-bye.